This is the sound of OSA, obstructive sleep apnea. People who suffer from this condition actually stop breathing in their sleep up to 40 times an hour. Stay tuned to find out more about obstructive sleep apnea.
Hello and welcome. Today we're going to learn about obstructive sleep apnea. What causes it? Who does it affect? What can it lead to? And most importantly, what can be done to help treat this very serious and grossly undiagnosed condition? If you find yourself extremely tired during the day, if you think you may have excessive snoring, headaches, or memory problems, if you wake up often in the middle of the night, if you seem to never get a good night's sleep, you may suffer from obstructive sleep apnea. Today you'll learn there's an easy and painless way to relieve your sleep apnea symptoms. You'll discover how to put an end to your restless nights and your daytime exhaustion. The solution is simpler than you may think. Stick right here for the answer and relief to your obstructive sleep apnea.
Attention Cpap users. Stay tuned to learn about a highly effective alternative treatment for OSA without the discomfort and side effects of the Cpap mask. An estimated 12 million Americans and many more people suffer from obstructive sleep apnea. Despite being so common, many people may not know they have OSA. Up to 82% of men and 93% of women with moderate to severe OSA have not been diagnosed and, therefore, don't get treated.
I'd like to introduce you to Dr. Richard Klein. Dr. Klein heads up the Michigan Head and Neck Institute in Warren, Michigan. He's a specially trained neuromuscular dentist who studied, lectured on, and treated patients with sleep apnea and TMJ dysfunction problems for more than 25 years.
Hello, I'm Dr. Richard Klein. The best way for you to understand what sleep apnea is for you to visualize it. So I have created and patented this model that I use with my patients that shows sleep apnea. When you're awake and you're breathing normally, the air comes in through your nose or your mouth, goes to the lungs like it's supposed to, and the bad air exhales like it's supposed to. But what happens with sleep apnea is this. Gravity, as we're sleeping, pulls the tongue, the jaw, and the soft palate backwards, and it collapses and crimps. Think of a garden hose. You crimp it so the water can't get through. When this crimps, the air can't get through, the good air can't come in, the bad air gets trapped, can't come out. So after a brief period of time, maybe 30 seconds, the brain understands this is dangerous. So it makes you cough and open it up. You gasp and you have an open airway. So after a few moments, you relax, you fall into deeper sleep, and it collapses once again. Once again, your body reacts as it should, and you gasp and open up. That repetitively happening all night long is sleep apnea.
I would often wake up, I'd be sleep deprived. I had symptoms in the afternoon. I would be ready to go to sleep at 3 or 4 o'clock in the afternoon. My family suffered because I would have all these ideas of what to do when I got home and none of the energy to do them. Headaches, colds, lingered on. My whole life was affected by it, and the others around me as well. I would feel at 3 or 4 o'clock like you normally would feel at 10 or 11. And then I'd go to sleep at 10 or 11, and I'd be awake at 2, 3, 4, 5, and have to get up at 6. It was a big problem for me for many years. I would just prefer to sit, and I know it contributed to weight gain. I was depressed. I had people saying you should go to a psychologist, psychiatrist to find some medication to pick you back up in the afternoon. But that wasn't the answer. The answer was I was never getting enough sleep.
Attention Cpap users. Stay tuned to learn about a highly effective alternative treatment for OSA without the discomfort and side effects of the Cpap mask. If you think you may have sleep apnea, do not let it go untreated. The most important thing you can do is call the number below. Get tested. Find out if you are affected, how severe it may be, and what Dr. Klein and the Michigan Head and Neck Institute can do to get you back to a normal, energetic, and happy life.
So you may be wondering, who's at risk for OSA? Who does it affect? Could I have OSA? According to the American Sleep Apnea Association, sleep apnea is a very common problem, but the people who are most affected are men, overweight people, and people over the age of 40. However, anyone can suffer from OSA, men and women of all ages, even children. More than 12 million people are affected by OSA, but due to a lack of awareness, so many remain undiagnosed. What are the consequences of untreated sleep apnea? The consequences and effects of sleep apnea are more serious than people realize. Left untreated, OSA can cause high blood pressure and other cardiovascular diseases, memory problems, weight gain, exhaustion, impotency, and headaches. Moreover, untreated sleep apnea may be responsible for job impairment, relationship problems, and motor vehicle crashes. What can be done to treat sleep apnea? One of the most common treatment methods for sleep apnea is called Cpap, or continuous positive airway pressure. This treatment can be effective, but at the expense of many side effects and inconveniences. Here's a typical mask that would be used with Cpap treatment. If you have one of these, you're probably familiar with the problems and discomfort that can go along with it.
I had already been through the Cpap situation. That didn't work. You got this tube and headgear. Can you do that, or do you have to sleep on your back? I don't sleep on my back. I sleep on my side, so that would be a problem. If I turn all the way around, can I do that? Because will the cord go around my head? It's forced air. You're trying to breathe through one way. It's not natural. It's not a natural way to breathe. They're forcing air into your body. But it's not something easy to get used to. But when they put that thing on, machine on me and strapped it on my head like a helmet, and I tried to breathe through it, oh yeah, claustrophobia, yes, frustrating, yes, because I needed this thing to work. That just wasn't working. Anytime you have something in your nose, whenever you have blockage of any kind through the winter, how do you force air through noses and heads that are clogged? I don't know what you do. You just don't use it. That's what you do.
Attention Cpap users. Stay tuned to learn about a highly effective alternative treatment for OSA without the discomfort and side effects of the Cpap mask. If you think you may have sleep apnea, do not let it go untreated. The most important thing you can do is call the number below. Get tested. Find out if you are affected, how severe it may be, and what Dr. Klein and the Michigan Head and Neck Institute can do to get you back to a normal, energetic, and happy life.
It's important to know there is another option to treating sleep apnea without the side effects of the Cpap or the mask. It's called an oral appliance, and it can be just as effective in treating sleep apnea, but without the aggravating side effects of the Cpap mask. Dr. Klein exclusively treats headaches and sleep apnea with oral appliances, and he's going to tell us more about how they work.
This is what a sleep apnea oral appliance looks like. You can tell it's small, it's a little mouthpiece, fits in your mouth. How it functions is quite easy. As I explained before, gravity, when we're sleeping, pulls the jaw back, collapsing the airway, and you can't breathe. The oral appliance simply keeps the jaw forward. It attaches. We need to keep that jaw forward. It attaches to the upper teeth, to the lower teeth, and it keeps the jaw in position so that it can't collapse. It keeps it forward so the jaw doesn't go backwards. That controls sleep apnea all night long.
I mean, it's a upper and lower mouth guard that connects, and it's very fitting. Just snug on the top, snug on the bottom. Connects very simply, boom, boom, and you lay down. No, plug it in, turn it on, strap it on. Which way am I sleeping? Can I get comfortable here this way? And I got fitted for it, tried it, and it works. Within a night, you were used to it, and it's very easy. I mean, there's really nothing to it. That's the best part about it. This, you can do whatever you want. You can run out with it on, or you can just take it off quickly and go about your business.
If you think you may have sleep apnea, do not let it go untreated. The most important thing you can do is call the number below. Get tested. Find out if you are affected, how severe it may be, and what Dr. Klein and the Michigan Head and Neck Institute can do to get you back to a normal, energetic, and happy life.
An oral appliance, a simple, compact, effective device to treat sleep apnea, but more importantly, a potentially better option for users of Cpap devices. Let's take a minute to dive deeper into the problems with Cpap. I'd like to quote now from the American Sleep Apnea Association. It's one of the most recognized organizations for OSA. Quote, current research estimates that the non-compliance rate for Cpap, how many people use Cpap more than a few months, is approximately 60%. One reason for this may be that Cpap users often experience disagreeable side effects and simply stop using Cpap. Let's take a closer look at these side effects. They include mask discomfort, nasal congestion, irritation or runny nose, difficulty breathing through your nose, headache or ear pressure, air in the stomach, the air is too cold or too hot, the tubing gets in the way, taking the mask off at night and not realizing it, or worse yet, not being bothered to put it back on. Sleep apnea is a relatively new field of medicine. Only recently has it been shown that the stoppage of breathing in sleep apnea causes every cell in the body to briefly suffocate with lack of oxygen. Physicians know that during sleep apnea, a person stops breathing and inhaling oxygen dozens of times each hour, some people several hundred times a night. This causes type 2 diabetes, hypertension, stroke, fibromyalgia, ADD, heart attack, and even death. But there is good news. Apnea is controllable. Those who can't or won't wear a mask find the new oral appliance from Dr. Klein much more comfortable. It's medically accepted and custom fabricated just for you. The acrylic mouthpiece is very durable and requires virtually no maintenance.
I get a deep sleep that I was never able to get. That the person that should be here is really my wife, because she benefits probably as much as I do, because she gets a better night's sleep because she's not listening to me snore and all the other craziness that sleep apnea brings. I can go to sleep and set my alarm clock and be woken up by the alarm clock. It's nice now to actually go out to dinner and say, well, do you want to do something else? You know, it's 9 o'clock. Instead of saying, it's 9 o'clock, I'm done, I'm ready to go to bed now.
If you think you may have sleep apnea, do not let it go untreated. The most important thing you can do is call the number below. Get tested. Find out if you are affected, how severe it may be, and what Dr. Klein and the Michigan Head and Neck Institute can do to get you back to a normal, energetic, and happy life.
Regardless of how you've been treating your sleep apnea, the most critical thing to do is continue the treatment. If the device you're using has side effects, discomfort, and inconveniences, it may just be a matter of time before you stop using it. You can avoid these side effects and still relieve your sleep apnea with an oral appliance from the Michigan Head and Neck Institute.
Yeah, I mean, if you have sleep apnea or you can't get a deep night's sleep for whatever reason, you don't have to suffer. You don't have to wake up your wife. You don't have to wake up every few hours at the slightest noise. You don't have to be depressed in the afternoon and tired and ready to end your day before it's really begun. You could come here, you've got a device that will give you that sleep that you can't get any other way naturally. So do yourself a big favor and go see Dr. Klein and get some sleep.
Remember, sleep apnea is controllable. If you think you have it, please get tested. If you currently wear a Cpap, there is an alternative. Call the Michigan Head and Neck Institute. We can custom fit you with an oral appliance. I'm Dr. Richard Klein. Thank you for listening.